Welcome everyone to the webinar today that's entitled Game On, Building Capacity with a Fun, Engaging Supply Chain Management Digital Game. This is one of the webinars that we're organizing with the Youth Caucus in a series of webinars where we've presented Innovation Fund projects related to the youth subject. This webinar today is the last one in a series of 5 projects that we have presented. Today we have Zoya Mohamed with us. Zoya works for JSI, the inSupply project, a project that works on innovations for public supply chains. And Zoya will present us today 2 digital games that JSI has produced. One is the supply chain management game, and the other one is the contraception game that was produced with support of the Innovation Fund from the Reproductive Health Supplies Coalition. After the introduction that Zoya will give us on both games, we will also be playing the games itself. So practically some things on this webinar. First of all, we'll have Zoya presenting all the work that they did. Afterwards, we'll have a short Q&A session, and then we'll be all together playing the game. So it's very important that you all make sure that you have your phone, your laptop, or your tablet in front of you so you can play together with us. There's a possibility to raise questions. So you have 2 ways to do that. One is to raise your virtual hand. As you'll probably see on the box of the webinar, you'll see a little hand that you can click on, and that way I can see that you want to raise a question and I can give you the floor to raise that question. The second way to raise a question is to type down your question in the question box. I'll make sure that we moderate all the questions and we send them to Zoya so she can respond. And then lastly, as always, we'll make sure that the presentation and the recording of this webinar is available on our website, and I'll definitely send it around afterwards. So I think we can start. So Zoya, the floor is yours.
Thank you so much, Emily, for that introduction. So as she mentioned, today I will take you through one of the projects implemented under the RHSC Innovation Fund, which was using the Health Games platform to target youth and adolescents using continuous mobile gaming to really raise awareness about sexual reproductive health and connect youth communities within Kenya. So you'll notice that the title on the screen that you see is different to that of the webinar. This is because we will try focus more on the work that we did under the grants, but once we start with the demonstrations, we will play the supply chain management digital game as well. So let's start with why we thought health gaming is important in the first place. So we noticed that particularly in Kenya, there isn't a credible youth-friendly source of information for sexual reproductive health. While schools are mandated to provide this information, this isn't the case usually because of the cultural and religious context that we are in and the differences that we experience. So youth therefore tend to receive this information from their peers or they are self-taught, and therefore the information that they learn from their peers or self-teach is not always accurate or credible. So the idea was to provide credible quality content in a fun, sustainable way, and in this way it was through gaming, by developing a youth-friendly platform to raise awareness about contraception, sexual reproductive health, and dispel some of the common misconceptions amongst youth. We also wanted to connect youth communities here in Kenya via gaming. So the Health Games project is hosted on the YIPA platform. YIPA is a web application and can run on any device, so a laptop, mobile, or a tablet without installation. Because it's a web application, you need internet. However, the game itself and the platform has a really low bandwidth. So loading times are pretty fast and you don't really need a 4G connection. So what distinguishes YIPA from other learning platforms in the market is that it can provide real-time analytics. And we will see in a few slides down what kind of analytics it composes of. The games that we have so far developed as part of Health Games are all multiple choice games. and it allows you to interact with players that are already online, and it also allows for multiplayer. The benefit of gaming versus face-to-face training or traditional classroom training is that with classroom training, it is really difficult to follow up on knowledge acquisition in between sessions or in between training. So what gaming really does is it allows unrestricted access to content and to learning at your own schedule or time. So you actually transform the learning curve from a cyclic learning curve to a continuous one, where gamers are self-motivated, and using the Health Games analytics, you can actually identify areas that you have gaps in and possibly need further learning in. So currently on the YIPA platform, as Emily mentioned, we have 3 games. The first one is the Healthcare Supply Chain Management game. So this game provides foundational content on your supply chain, introduction to logistics. In other words, it is a supply chain game for beginners. The content here is derived from JSI's Supply Chain Manager's Handbook, and it's targeted towards health workers who handle health commodities. We have the second game, which is Your Choice, Your Future, which is a contraception game that we developed under the RHSC Innovation Fund. The game was developed to create awareness around contraception choices and dispel some of the common myths around sexual and reproductive health. And finally, we have the Building Healthy Lifestyles game, which was developed under the GIZ Lab of Tomorrow grant under the theme of non-communicable diseases. This game equips you with tips to help make informed decisions about leading healthy lifestyles, and it covers various topics such as nutrition, road safety, and NCDs. Particularly the Your Choice, Your Future and the Healthy Lifestyles game is targeted towards youth and adolescents. So under the grant, JSI developed the Your Choice, Your Future game, like I mentioned, and we hope to achieve a few objectives. The first one is really to build awareness and knowledge about contraception and sexual reproductive health and dispel common misperceptions that are prevalent amongst youth and adolescents here in Kenya. The other one was to really promote a sense of community and friendly competition between different cohorts amongst youth and adolescents within Kenya. Initially, we hoped to do this across countries, but due to the limited implementation time, we managed to do it within Kenya. So within the 7 weeks of implementation, we also had something called continuous mobile competitions, which technically were to extend the reach and impact of World Contraception Day, which was last year, September 26th. And World Contraception Day is the day which we had officially announced and launched the game. And we wanted to extend some of the activities that generally tend to concentrate only on that day over the course of 8 weeks. As part of some of the local launches, we also wanted to involve some of the health workers, particularly nurses, who had clinics and facilities offering sexual reproductive health services to youth in the area that we were conducting the launch, to sort of provide links to the adolescents and youth to offline resources, particularly for youth-friendly sexual and reproductive health services. And like I mentioned before, in the same line of promoting a sense of friendly competition, we wanted to develop a community of adolescents where we wanted to allow them to share experiences and knowledge about sexual reproductive health, and we try to do this using our social media pages. We had a Facebook and Twitter page to enable this. So I'm sorry, this is a really busy slide, but this just summarizes some of the results achieved for the games. You'll see that the results are combined for the Healthy Lifestyles game as well as the Your Choice, Your Future game, which we launched together. So you can see above on the top part of the infographic that we managed to target and reach more than 1,000 players, 53% of which were female, and the mean age was 24. Our initial target was to reach adolescents and youth between the age of 15 and 24, so this was right on our upper percentile of that range. We had a few launch sites within Kenya, mostly university campuses, including the Kenya Institute of Mass Communication, Kenyatta University, University of Nairobi, and ACWIT, the African Center for Women, Information and Communications Technology. So over the course of the 8 weeks, players were able to answer questions more than 240,000 times. You'll see at the bottom, these are some of the results that we achieved, which I'll take you more in detail over the next few slides. But one of the key things we achieved was sort of improving knowledge acquisition over time. You'll see that the number of players who scored 50% and over increased for both games, so for both the Healthy Lifestyles game and the contraception game. So for the contraception game, we had 3 levels of increasing difficulty. So this slide just shows the correct responses by level. Level 1 had the highest success rate, while level 2 had the lowest success rate. Why this slide is important is really for content development, to really see if what you actually think is difficult is also difficult for your target audience, and if not, you should know why. So like I mentioned, one of the indicators that we used to measure knowledge acquisition over time was the success rate. So this was measured by a score that each player got every time they played a gaming round or a game composing of multiple choice questions. So over time, the number of players who achieved a score higher than 50% increased. You'll see the general trend of increasing. However, you'll see in week 48, which was one of the last weeks of our implementation, we saw a dip in the success rates. This is because within our cohort of players, we had a lot of newly registered players in this week who are not familiar with utilizing the jackpot feature, which I'll show you again later when we do the demonstration, and who are not also familiar with the content as were the continuous users. So for each gaming round, you have 60% new questions and 40% repeat questions. So of course, the continuous users would be more familiar with that content compared to the newly registered users that we received and registered in that week. So this is one of the quotations of a youth participant who played the game, and they said, "I can see myself at the top. I can't stop playing. Playing this, I urge my friends to join me in the game and get to know our reproductive health well." So this was really encouraging for us to see that the game actually engaged youth in learning a topic or content that they might not be as interested in if they were to learn in a classroom-based setting. So these are some of the questions that were the highest scoring at each level. As you can see, there is no specific characteristics of the questions that users answered correctly. So some were scientific, others were more scenario-based or experiential-based. So for level 1, it was more of a scientific question that was answered most correctly. So which of the following is a disadvantage of using the pill? And for level 3, it was more of a scenario-based question. The same goes for the lowest scoring questions. Again, there were no specific characteristics of questions that were answered least correctly. They were both a combination of scenario and scientific technical questions. And I think this was an area that we learned the most. It was a big lesson learned, especially in way of content development. We could have restructured the game where each level represents a topic rather than of increasing difficulty, so that if the level that had the lowest score would be an area of program intervention. So as part of the content development, we also included something called perception questions. So these questions don't have a correct answer, but rather we wanted to know, for example, how many users believed in some of the prevalent myths and misconceptions, as well as things like contraception use and the biggest barriers to contraception use. So as you can see from this slide, 64% of gamers responded that they had used a form of birth control at some point. But what is more interesting is that we made an inference from the results. The same percentage of users that had easy access to youth-friendly services for reproductive health needs also had access to the birth control option of their choice. It was the same percentage at 78%. So a possible intervention in this case is to narrow the gap in the access to youth-friendly services, which may fill the 36% gap in access to birth control of their choice for the youth. Another perception question asked was, do you feel that access to birth control encourages engagement in sexual activity? And through research and testing the content with the Youth Caucus, we found out that this was one of the most prevalent myths surrounding reproductive health. And in the course of the 6 weeks, 8% more users did not believe in this myth. So we were comparing week 41, which was the first week of implementation, to week 47 and 8, which were the last 2 weeks of implementation. So it's very interesting to see the change in opinion or the change in beliefs by playing this game. So this slide just shows the usage patterns by users of the platform. It's a rather chaotic illustration. So each line represents the number of items or questions played by each continuous gamer over time. So as you can see from the illustration, there is no distinct usage pattern. This reflects on the unrestricted access that the game provides, where gamers can play wherever and whenever they wanted. So gaming offers this freedom to use, play, and learn at any time, which is critical for knowledge acquisition for youth. If you offer the same content via face-to-face learning or in a traditional classroom setting, it might restrict the engagement by the participants and therefore learning. So there are a couple of things that we learned through the course of this project. Of course, youth found gaming to be fun and engaging, and therefore they preferred gaming to workshops or seminars. And we also learned a couple of things about the learning behaviors of youth. We use incentives which were particularly important to engage youth to keep on playing. So for our weekly mobile competitions, we rewarded the continuous players and the highest scorers with airtime or data bundles. At the end of the implementation and at the end of the tournament, we rewarded players, again using the same criteria, with smartphones and tablets. So it's really important when you develop content for the game, depending on your target audience, to really see what are some of the incentives and motivating factors for your target audience to continue playing. Again, it is also really important to have on and offline resources connected to the game, which adds value beyond learning. At the end of the day, we hope that this increase in knowledge acquisition translates to maybe an increase in service uptake. So we had nurses at 2 of our launches to help address questions about contraceptive methods and access to youth-friendly health services in the area that they worked in. We also had the social media pages again to enable continuous engagement with the gamers. So what else for the gaming platform? What are the additional or potential areas of future application? Some of the potential applications we've been following through with is one, the blended learning approach. So supplementing traditional classroom learning with gaming. And gaming really provides the real-time analytics to measure competency. Another application was this whole idea of a creation of a youth portal. Having the source of quality, credible information, health information for youth, which gaming can be part of, allows standardized content as well as verified quality, credible content that youth can access. And we'd probably use a multi-sectoral approach for content provision, so including the government, including academia, and including other various stakeholders for providing this content to youth. We also Another application we also delved into was development of skills and continuous professional development using the game. So we currently working with the Pharmaceutical Society of Kenya to possibly see if we can use the platform for standardization of content for pharmacists and for continuous professional development. This was also why we created the supply chain management game to particularly improve and refine the supply chain skills of health workers that deal on an everyday basis with health commodities. So that was my last slide before the demonstration, but it would also be very interesting and would also love to hear from you all about any other potential applications you see that are relevant for the platform, or when we play the game, what your feedback or comments would be of the platform and any areas of improvement.
Thank you, Zoya. We have one question I see from Eric Muringu. Eric, I'll give you the floor so you can ask your question. I'll unmute you. Hi, Eric. Do you hear us?
Hi, everyone. Can you hear me?
Yes, perfect.
Yeah, this is Eric from the Pharmaceutical Society of Kenya. I just heard you mentioned it, and it's true. We are planning to adopt this method as part of our CPD training. I'm standing in for Dr. Daniela. She is not in the meeting, so I only raised the question because I couldn't get the connection right, but now I'm hearing.
Thank you, Eric.
Hello. Yeah.
Okay, are there any other questions? So as mentioned, you can raise your hand, virtual hand in the box, or you can put a question in the question box. For now, Zoya, maybe I have one more question. Are you thinking of opening it up for other countries as well, or will the focus be on Kenya for now?
Well, under the grant, we only had the capacity to do it within Kenya, but of course, we would love to scale it up, seeing the success rate and the results that we achieved, and really building this whole youth community amongst countries so they could share experiences. So we're really open to the idea of scaling it up. Again, I guess the question to consider is the cost of the platform and how we can scale that up in a sustainable way to include more users and increase the capacity of the platform.
Okay, great. We have one more question from Greg Sable. Greg, I'll give you the floor. Can you hear us? Greg, are you there? Okay. Might be a mistake. So I think that's where we are for questions for now. I think we can leave maybe other questions for later after the game, but maybe we can just start playing the game now and then we can see if there's more questions afterwards.
Sure. So before we go into the game, I just want to give you a few instructions to log in. I hope you all have your devices out, either a mobile phone, laptop, or tablet, and connected to some sort of internet connection. So it's a web application. So this is the URL to connect to. It's www.health-games.org. So we have created a certain registration code for your login. So the registration code is 4040. Once you enter the registration code, you will be asked to create an account. So what you do is you fill out your account details, in particular your nickname and your password. Because the next time you log in, your nickname and password will be your subsequent login credentials. So please try and remember them. And then once you create an account, we will start playing the game right away. Just how to play. As I mentioned before, questions are designed as multiple choice. So you are playing in direct competition with members of your group or anyone that's playing online. You can only proceed to the next question if all the members of the group have answered the question. However, each question has a maximum allocated time. So in the case of the supply chain management game, you have 45 seconds to answer the question. And for the contraception game, it depends on what level you're playing at. Level 1, I believe, is 40 seconds, and then it decreases thereafter. I mentioned earlier that there's something called a jackpot feature. And this is what really makes the multiple choice questions a game. So what the jackpot feature is it's a means or way to double your points. So if you are certain of your answer, what you have to do is you have to click on the jackpot feature on the upper right-hand corner, and I'll show you where that is located, before you click on the answer to double your points. However, the gamble here is that if you get the answer wrong, you lose all your accumulated points. So I'm just going to direct all of you to the landing page. So if you could please all type the URL health-games.org, and from there we will see how to continue. So if you can all type in the URL on your device, and once you do so, you'll see a landing page like this. So I'm just going to give you a minute to do that. All right. So once you're all on this landing page, the next step is to enter the registration code, and for this session, the registration code is 4040. Once you do that, you select Create Account. And then fill in the details that it's requesting you of. So remember that your nickname and your password will be your subsequent login credentials. So please remember those. And your initials can only be 2 letters. So your nickname is what others will see you on the platform as. If you're having any trouble or any questions about logging in, you can raise your virtual hand, and then Emily will let me know. Probably going to give 1 more minute. Hopefully you'll all see this landing page. All right, so as we wait for the last few people to reach this landing page, before you start playing, I just want to show you how to play the game so that we can all maximize on our scores. So when you click on a particular game, you will find that you have 3 modalities to play the game. The first one is play along, which is what we will use today. Play along is when the system divides you into groups of players with whoever is playing online. With organized group game, each group can compose of 5 to 6 members, so you can personally invite a peer or a colleague to play within a group. Train alone is when you actually want to learn more about the content or the topic at hand, but with the train alone modality, you do not accumulate or earn any points. It's just to learn more. So do not select anything. I'm going to show you how to maximize your score. So as you can see, I'm using the play along method. And I have a multiple choice game question right in front of me. So I'm going to just answer this. Which of the following is not a major activity? I'll select an answer, and you can see that I've earned 26 points. Now for the next question, if I'm positive 100% sure of the answer, I click on the jackpot, which is in the right-hand corner up here. I select it before choosing the question. So if I know the correct answer, then I select it, and you'll see that I've doubled my points. However, if I click on the jackpot, which I'm going to do here, and I get the answer wrong, then I go down. Oh, I got it correct. I apologize. Let me get a question wrong. Select the jackpot. Select the wrong answer. I still got that correct. 1 second. If I get it wrong, I lose all my points because I selected the jackpot. So that's how the game works. You really have to use the jackpot feature to maximize your points. And after you play a gaming round, which entails 6 questions, you see a ranking page. So I think let's start with the contraception game. If you can all select contraception level 1 game. And select the play along modality. And you can start gaming. So happy gaming, and let's talk after the 1 gaming round. So right now we're just waiting for the program to organize us into gaming groups. Okay. All right, so my group has finished playing one gaming round, and it seems like AU won the gaming round with 476 points. So if we're all on this ranking page, if you scroll down, for all the questions that you got wrong, they'll be highlighted in red, and it will provide you with the right answer and also take you to other online sources of information to help you answer that question in the future. So it provides you learning hints and tips which you can use for the next time you play the game. And every evening, if you register with your email, you get an email of all these learning hints and tips so you can keep them in your record. So I think let's play another game. We could play another round of the contraception game, but in order to also see what the supply chain management game is about, if you select play on the side again or on the top, and you scroll down to the healthcare supply chain management game, so you select either, I'll just wait for everyone to get here. Anyone having trouble getting here? All right, so once you're here, again, select the play along modality and begin gaming. So my group is done. And again, you come to the rankings page after you play a gaming round, and below you find some of the learning tips and hints based on the questions that you got incorrect. So you can really see that this platform is content agnostic, so you can really develop any content around any topic and translate it into a multiple choice game. You can add pictures and more illustrations as you develop the questions, but bear in mind that the more pictures and illustrations you add, the more bandwidth it will require, so your loading times will be slower. Any questions? And also, we would love your feedback on how we could improve the platform. Is there anything that we could do to make it more user-friendly? So we would love your feedback.
Thanks, Zoya. This was great. I think you gave a good idea of how the game works, and it definitely gives you a lot of good feelings about trying to play again after this meeting. I have a couple of questions. One was from Greg, whose microphone didn't work before, and he was wondering whether the YIVA platform is open source and can be used by any organizations, or whether you need to pay for it to work with the platform.
Right. So the providers of the YIPA platform do charge a fee. They charge a license fee, and they usually do it per user over a specific period of time. So for example, 10,000 users over the course of a year. So one of the lessons learned under the RHSC grant as well as the GIZ grant is to really establish a more sustainable costing model. And we are in negotiations with the platform provider to provide a more sustainable costing model. But under the RHSC grant and the GIZ grant, for the two games, the value of the grant was $80,000. But again, this depends on what customization you need, depending on your target audience, and also some of the analytics that are required. So again, we are in negotiations, and no, it's not open sourced. It's a license fee, and they usually do it per user.
Thank you. And then we have two more questions from Veronique Dupont. The first one is, did you address how you recruited because she wasn't on the webinar in the beginning. Did you address how you recruited the more than 1,000 users, and what are you learning about them, their age group, gender, urban, rural, educational level, or wealth quintile?
That's a good question. Thank you, Veronique. So most of the 1,000 youth that we were able to register were based in university campuses in Nairobi and Kisumu, so many around urban centers. What we did is we had physical launches at each of this university campus where we would recruit some of these gamers. In terms of some of the behaviors that we learned, they really enjoyed, again, using some sort of fun, interactive way to learn about content that they usually would not be interested in a classroom-based setting. One of the major glitches that we did have was internet provision, but I think over the course of the 7-8 weeks, it got better because, like I mentioned, the game is very so the internet connection that you require is rather low. But because youth and adolescents are always on their phone these days, having something that is on the devices that they use constantly was a great way in recruiting them and actually keeping them engaged for 6 to 7 weeks.
Okay, thank you. And she also asks, have you found that you have had to adapt the game to reach a certain youth group, or are you thinking about how you may better tailor the technology and questions to reach certain youth subgroups?
Yes, so certain questions based on the feedback from youth were too technical or scientific, and based on the local languages, some didn't understand English, so there's a possibility that we could translate it into Swahili. But one of the key feedbacks was to keep the language simple. So going forward, we would hope that, again, we would be given more time to beta test the content before we go live with youth groups. So that was one of the main feedback that we have. And another one was that because they kept playing a lot and they answered a lot of questions, they exhausted most questions in the question bank that we had for each level. So again, always every week we would introduce more content, more levels, more questions to keep them on their toes and keep them engaged.
Okay, I think that were the questions that were raised from the group. If there's anyone else who'd like to ask a question, please let us know by raising your hand or putting a question in the question box. So yeah, how long can you play the game? Because I can imagine if some of the content comes back and some of the content is renewed, you can play it for a very long time.
Yes, it's endless, but like I mentioned, for each level we have a limited number of questions. However, in each round, you have 60% new questions and 40% repeat questions, just so we emphasize on the continuous learning and repetitive learning. So once you've exhausted the question bank, you will most likely see very familiar questions come again. So for this, you can play endlessly, but there's a limitation in the number of questions we developed for the few levels that we had.
And are you planning to do another like you focused on the contraception World Contraception Day? Is there any other event coming up where you'll do another campaign around the game?
Yes, we're hoping to do so, but we're also trying to focus on NCDs, which is based on the disease patterns here, is something that it's going towards. So we're also trying to expand the Building Healthy Lifestyles game under a couple of contracts and grants we're hoping will come through. So and contraception will always be big here in Kenya, and reproductive health. And we've established that it's a huge gap in terms of information for youth. So we're hoping in the future to scale up and maybe expand the game.
Okay, well, thank you very much. I think we had all the questions. So as mentioned, we're going to put the recording of this webinar online as well as the presentation that Zoya gave. So Zoya, I want to thank you very much for this great presentation, and I will also send around maybe the link also so that more people can play this game, because I think it's just fun, but it's also a lot of information that's out there that will be great also for the Youth Caucus members to play more on it. So thank you very much for setting this up for us. And if anyone has any more questions that pop up later today or in the coming weeks, then please just let us know and I can forward it to Zoya. Thank you very much.
Thank you so much.